So if you're admitted to a typical hospital and you're an older adult and you improve, say from, with treatment for a pneumonia, maybe you're a little bit weak at the end of that treatment and you'll maybe be, the physical therapist who's also meeting you for the first time suggests, I don't think this person's safe to go home. But of course, they've never been in your home and they don't know how you function in your home. And that person, with all good intent, suggests that you should go now to a skilled nursing facility. It's easy to get a stamp in your healthcare passport, stamp the visa that takes you from the hospital to the skilled nursing facility, right? Because it's just an easy glide path. Those processes and procedures are well greased. And as you know, on a Friday afternoon, many people are getting that visa stamped and moving from a hospital to a skilled nursing facility.
It's really interesting because, a very typical statement from a patient once they're in the hospital says, well, it's time for discharge. And says, but the patient's not well yet. And it's, well, that has nothing to do with discharge from the hospital. Discharge from the hospital just means that there's nothing that needs to be done in the hospital. So if you're not well yet, you go to the skilled nursing facility.
It would be like me going to the hospital president and saying, hey, hospital president, hospital at home it's just the best thing ever. Patients do better. Patient and their family members love it. They have lower rates of complications. The quality of care is better and safer and all of that. And they would say, okay, and how does the hospital get paid for this? And I would say, well, here's what's going to happen. I'm going to take a patient out of the emergency room who would have gone to a bed in your hospital for which you would have gotten a payment from the Medicare program. But instead, I'm going to take them home. And because there's no payment, you're not going to get any money, but you will have done God's work on earth, right? And, then they look at you like you have two heads. Since November, now over 150 hospitals have gone for the waiver across over 30 states. So it has really gotten an enthusiastic reception across the country.
What would be your dream come true for healthcare for seniors in decades ahead?
I think what I'd like to see, Warren, is a great question. And it's hard to invent perfect systems. But I think what I would like to see is a system that is more firmly based in the home and community setting rather than the bricks and mortar. I think it's, if we always talk about right care, right time, right place. And, usually that conversation means the patient going somewhere to get care and somehow make sure that they're in the right place. When in fact, if you enter an emergency room, chances are you may get admitted to a hospital, whether you need it or not. So I think, my ideal care would be patients at home and, they have good primary care, whether that's based in an outpatient clinic or whether that's based at home. And as they move through their healthcare journey, health and social care journey, they get what they get. And if the care in any conceivable way can be provided in the home, it should be provided in the home, whether that's emergency department care at home or primary care or palliative care or acute hospital care or rehabilitation care, all augmented and built with a foundation of, a social system that supports people in the right kind of way and gives them the doses of that kind of care that actually tend to reduce the need for healthcare. We tend not to get a great return on, Don Berwick, healthcare geniuses. We basically run a repair shop as opposed to a health shop. I think the biggest challenge and the thing that's going to be the most interesting thing to overcome is really changing the culture of healthcare, right? Because it's still very based in facilities and bricks and mortar. It's organized that way. The payment is organized that way. The culture is organized that way. So changing that culture is going to be, I think, the most challenging thing.
Yeah, what I say about that, Bruce, is we got to change the center of the universe from the medical center and make the center of the universe the patient instead.
Absolutely. I couldn't agree more.